Osteoarthritis. To remember, principally, this is a degenerative bone disease. And second important thing, it's a localized disease. It do not have systemic manifestations, major systemic manifestation. It's a localized disease. Are you getting it? Yes. Hereditary component is there. Hereditary component is there. It is more with the female than the male. Can you tell me why it is more with the female than male? Yes. Deposition of calcium in the bone in female depend upon estrogen. After menopause, the level of estrogen in female significantly reduces. And that is the main reason why osteopathies are common in an old age woman, including osteoarthritis. You can very easily recognize this thing in the society, that whether you are having more females or more males with osteoarthritis. Very easily you can come to the conclusion that there are more female having osteoarthritis. Getting my point? Yes, females are more. Getting my point? Yes. It is because of the estrogen issue. It is the most common form of chronic disorder of synovial joint. Knee joint and hip joint. Most common is knee joint. Knee joint is most common. Why? It is a weight bearing joint. Major weight bearing joint is the knee joint. Am I right? Yes. And that's why that is the most common joint involved in the process of osteoarthritis, followed by hip joint. Followed by hip joint. Hip joint is also involved in the process of osteoarthritis. Am I right? Yes. Characterized by progressive degenerative changes. Slowly as the age advances, degeneration will go on increasing. Over years. It's not a game of a day or two. It's a very slow process happening over years together. Then if I ask you, how many days will be required to recover it? A day or two? Or few days? Few weeks at least? I used to tell to my patient that it requires some years to develop. At least give me few months to recover. Are you getting my point? Yes. The treatment of osteoarthritis should be given at least for 6 months. If you want really to change the scenario of its destruction, you have to change the whole scenario from destruction to regeneration. Are you getting my point? It requires time. It's not possible easily. What people are expecting, you take some aushad, that medicine for osteoarthritis, few days. Dear, it requires 15 years to develop. Give me at least 15 months. If not, at least 6 months, at least 3 months, so that I can change some scenario. Are you getting it? Yes. That is the point with the treatment of it. It is a process of years together. And when your healing is there, at least it takes some months together. At least give me some months. It is especially seen in the weight bearing joints. Do you agree with me? Yes. Major weight bearing joint is knee joint. Knee joint is a major normal structure of the joint. Every word is important. What I am trying to tell you is important. Let us see. These are the two bones articulating in the joint, and that's why we call them articulating bones. Naturally, that bone is having this part. And this is the major part of shock absorption, and it is cartilage. As it is articulating two bones, we call it articular cartilage. The name comes from that. Articular cartilage. It is also known by the name chondro. It is also known by the name chondro. Chondro is the same. Articular cartilage is also known by the name chondro. And that's why chondro protective property means articular cartilage saving property. That is well established with ashwagandha. It is having that property. Are you getting my point? Yes. This is the muscle. Now do remember, this is the articular cartilage I told you. Around it is a fluid. You can see the fluid here. Can you see the fluid here? What is this fluid? Synovial fluid is there. Getting it? Now fluid has to be there in a capsule. And that's why. What is this? Synovial membrane. Yellow. Yellow is synovial membrane. Okay? Clear to everybody? They are in capsule. That is known as joint capsule. Joint capsule, synovial membrane, synovial fluid, and then articular cartilage. Getting it? Now, above that, above this capsule, this is the part of the muscle narrowing here. This is the part of the muscle narrowing here. Narrowing here. What is this? This is a part of the muscle narrowing and joining the bone, known as tendon. Known as tendon. Am I right? Now this muscle is there and this is the bone. They may rub with each other. And that's why body is having a soft tissue to reduce this friction between the bones and the muscle. And that is known as bursa. You can call it bursa or bursa. Why bursa is there? To reduce the friction between the muscle and the bone. I am telling you very basic anatomy. But that is necessary for you because what I am going to tell you, that is related. Now, I am having a person, my point is important. I am having a person who says that, Dr. Joshi, I am having knee pain. I am having knee pain since last 3-4 days. Going into the detail, asking him repeatedly, he says, no, 2-3 days. And that pain is superficial. Pain is superficial. It might be just tendinitis. It might be just tendinitis. Sometimes it is just bursitis. That is what common words used are soft tissue inflammation. Or the orthopedic surgeon used the word for it, some soft tissue inflammation is there. It's not arthritis, doctor. What they say? Some soft tissue inflammation. What do you mean by that? It is either tendinitis or bursitis. That may confuse you. Oh, it's osteoarthritis. No, my dear students. Sometimes, and that's why whenever I teach osteoarthritis, I use the word deep, localized pains. This deep word is really very important. Superficial pains are not osteoarthritic pains, my dear students. They are just due to some soft tissue inflammation. And what is that soft tissue inflammation, dear student? It is either bursitis, tendinitis. And that's why you should know the concept of that tendon. You should know the concept of bursa. These are localized, these are also localized pains. But they are very temporary. May last for 2 days, 5 days, 10 days like that. Bursitis is a little bit boring. But otherwise, boring, yes, it's boring, really boring. Many times it's immunological also. I should tell you that concept also. In the rainy days, many people come to you. It's actually immunological. It's not related to osteoarthritis. And that bursa is susceptible to that immunological attacks. If you go to Ayurveda, again I will be happy to tell you that that is a period where you call, there is Vat Prakop was a period. Vat Prakop kya hai Varsha Rutu. Very correct, very correct. You may getting good things, thing in a way. Getting it? Yes. You will be happy also. You become happy also. Yes, something is relating here. What I am learning is good also. Not getting? Yes. Bursitis, tendinitis are superficial pains. What do you require in osteoarthritis? Deep localized pains. Getting the difference, my dear students? Yes. Should I proceed? Then you know this articular, basically. What is osteoarthritis? It starts with this one. It starts with destruction of articular cartilage. Starts with the destruction of articular cartilage. And that articular cartilage destruction, then inflammatory cells, and then synovitis is secondary to it. Synovitis is secondary to it. First, destruction is this. Age-related destruction is the most common thing. But not always it is age-related. Many times it is related to some repetitive use of the joint. I had one dhobi, 38 years old dhobi, having complete osteoarthritis. Because of a very tragic story, he lost his father by the age of 11. He lost his father by the age of 11. And from the day, he says that I start my dukan, the shop, by 7 o'clock in the morning, and I will continue my work till 10 o'clock in the evening. The whole time the person is on legs. Best example of repetitive use of the joint. Having osteoarthritis. At the age of 38, died by the age of 45 by heart attack. That is a different story. I got it at the age of 38 in male. Because of repetitive use of the joint. Conductor is again a good example. Even though he is having the sit there, he doesn't sit. Again, repetitive use of the same joint. I am just trying to tell you the examples from our society that these people may be more inclined towards having osteoarthritis. Repetitive use of the joint is also an important cause of osteoarthritis. Are you happy with the words? Should I proceed? You got a joint completely, clearly, very clearly. This is the common structure of any synovial joint. Common structure of synovial joint. I have shown it for the knee joint, but it is common. Osteoarthritis. Can you see? This is a very advanced state of osteoarthritis. Advanced state. Whatever I am showing you is totally advanced state of osteoarthritis, where the one bone is eroding with another bone and there is complete loss of articular cartilage. There is complete loss of articular cartilage. The one bone is eroding with another bone. Now, I should tell you one thing. If you want to take the X-ray of the joint, my point is very important. If I want to take the X-ray of the joint, what I will see in the X-ray? I will see a good distance between the two bones. Point is very important. This will be the last part of the X-ray. This will be the beginning part of the X-ray. Shadow. Because this articular cartilage will not be seen in the X-ray. What you will see actually you will see the joint space. A well-maintained joint space means that articular cartilage is okay. It means that there is synovial fluid in between. And when it reduces, my dear student, there is destruction in articular cartilage. Synovial fluid may reduce. That is the point. You define osteoarthritis by seeing the X-ray. What do you see, my dear student, on the X-ray? You check only the joint space. I will show you some X-rays. You just check joint space. Reduced joint space is equal to osteoarthritis. Are you getting my point? Now here there is a great space available between the two joints, between the two bones of the joint. Am I right? Can you see here? How will be the X-ray in this case? One bone is eroding other, there will be no joint space. If it is in its beginning, there is reduced joint space. Are you getting my point? Very important words we are using. Types and pathogenesis. Primary osteoarthritis. Primary without any cause. Idiopathic. Old age typical. Am I right? Secondary is there, but secondary is having some cause. Repeated use of the same joint will be a primary or secondary? Secondary. Because you know that it is the repeated use of the joint that is causing it. Suppose I got dislocation due to accident. I develop osteoarthritis. Is it possible? Yes. Then I know that it is due to that accident. That will be secondary osteoarthritis. Primary means without any special cause. Idiopathic. It occurs in the elderly human more than men. Already I explained to you the role of estrogen. In female, deposition of calcium in the bone largely depend upon estrogen. If estrogen is less, deposition of calcium will be less and she will be more susceptible to develop osteoarthritis. And that is more with the postmenopausal woman. Should I proceed? The process starts in the fourth decade. Already I told you that there is balance. First there is great osteoblastic activity. Slowly the osteoblastic activity reduces and osteoclastic activity increases. That happens at 40. And after 40, slowly, what will happen? The osteoclastic activity will go on increasing and osteoblastic activity will be lesser one. Are you getting it? This is how the patient will be inclined towards osteoarthritis. And if she is female, after the age of 45, a major change will happen. What is that major change? Menopause. After menopause, there is significant decline in estrogen. And that's why availability of calcium for the bone will significantly reduce. That will add to this process of osteoclasis. And that is the reason that she is more susceptible to osteoarthritis after menopause. Now it has started in the fourth decade. Would you have the symptoms in fourth decade? No. You will have symptoms in sixth decade. Over years. The process is of years together. That is what I was trying to tell you. Are you happy with it? Steadily increase in the clinical symptoms, slowly the symptoms will appear. Little is known about the etiology and pathogenesis. Why in primary osteoarthritis it happen is not much known. The process of, you can say, a process of age. Am I right? Yes. Now a very important word is coming. You will be fed up of this word, nonsense word, and that is obesity. It's very difficult to treat the obese patient of osteoarthritis. Because of that age, because of the weight, there is great stress over the joint. And all your efforts will go into useless efforts if the patient's weight is high. Are you getting my point? Yes. You prefer to go with joint replacement. Is joint replacement is okay? Is joint replacement is okay or not? I should tell you very clearly. In very initial days, you can try with some other treatments like Ayurveda and this one. But once destruction is more, when destruction is more, the bones are about to touch each other. That is, erosion of the bone will start thereafter. It is always better to go with the replacement. Why I am telling you? That is very important. Pain is a component of osteoarthritis, my dear student. All of you know this point. Now suppose I am a person of say 67, 68 years old. I am having pain in my joint. What I will go for? Tablets. What are those? Painkillers. I am taking my risk at my kidneys. I am taking risk of kidneys. Now what will happen after 3-4 years? If I am consuming the tablets, I will have renal failure. And that's why I always suggest when the pain remains continuous, local application is not giving much relief. Walking becomes difficult up to a point where the daily activities are constricted. Then you should go for replacement. Otherwise, you go on taking the tablets as painkillers and that will create a new problem. Don't take this joint replacement negatively. It restricts the patient, but otherwise with the chair can have better life. Reduction in the joint joint pain is up to 90%. Some pain remains there because that is related to that operation and all that. Much improvement is there also. It is again the commercial part is there also. We know that commercial part is there also. But think about the betterment of the patient. Already told you that you can stop the process to very good extent when you meet the patient in the earlier days. You check the X-ray, you can see the joint space is well maintained. When you see that the joint space is well maintained, it ultimately indicates that it is the beginning. And you know that you can arrest that process. You can arrest that process. By giving good medicines, you can arrest the process, can prolong that process. Healing can be improved. Are you getting my point? Suppose by giving medicines and all that, suppose 7-8 years had passed. That's fine. That's fine. That is the extra time you get. But thereafter destruction is bound to come. It's a nature. When it is much more, you have to compromise with. Getting my point? Yes. And that's why don't go against the surgery. Try your best. Give good life to the patient. To some extent, you can extend the days. Are you getting my point? Yes. मी पेशंटला काय सांगतो, मी तुम्हाला जे औषध देतोय याने सर्वसाधारणपणे तुमचे रोजचे कामं बंद नाही पडणार एवढं मी बघेन. तुम्ही माझ्याकडनं जादूची अपेक्षा करू नका. माझ्याकडनं जादूची अपेक्षा करू नका. When you say so and you give relief, patient is very happy. Patient is very happy. Am I right? Yes. But that will last for few years. Because this destruction is a part of the nature. Osteoclastic activity, rise in the osteoclastic activity in old age is a part of the nature. Getting my point? Yes. Obese patient, aging and hereditary all contributes to the degenerative changes. Now, already I told you about secondary osteoarthritis, where cause is known. Where cause is known. You know that due to the accident, due to something there, trauma, it occurred at any age as a result of previous wear and tear phenomenon involving the joint. The history includes previous injury, most important. Previous fracture, where the doctor is not able to unite the bones properly. What I mean to say, if union of the bone is not in the perfect direction, if it is not perfect, then it will give you some deformity, and that deformity will create osteoarthritis. Are you getting my point? Yes. Previous fracture, inflammation, congenital dislocation. Congenital dislocation. Am I right? Yes. Now this is also very important. Now, this is one bone and this is the part that you are interested in. It is the articular cartilage. This is the another bone. And this is it's articular cartilage. Getting my point? Yes. Now what happens initially when the articular cartilage is going to destroy? Actually, the process is not linear, because you know that as osteoclastic activity is there, some osteoblastic activity is also there. And that's why actually when the destruction takes place, some regeneration also takes place. And that's why actually when you see it, it doesn't look like this. It will look like Are you getting my point? This is known as lipping. Some regenerative area is in between. Now some regenerative here, some regenerative here. And bone is coming close to each other because loss of articular cartilage is there, loss of sinual fluid is there. Now what happens? They will rub with each other. Now point is serious. When they will rub with each other, great pain will occur. And one point of time, it remains a possibility that a small part of it, that may break off. Are you getting my point? हलता येते, घासला आता एकमेकावर, तुटून पडेल. And if it break off here, it will lock the joint. and then you have to put the orthoscopy, you have to go for orthoscopy and remove it. That is what we call orthoscopic removal of this part. Are you getting my point? Now my point is very serious. When the joints are well separated, patient was normal. When they are coming close to each other, at the time of lipping, there will be great pain. Am I right? Now after few days, destruction will be more. Destruction will be more. Regeneration will be reducing, say after 2 years, 3 years. Now what happens actually, this lipping goes off. And if you take this surface, it will be like this. They are now very close to each other. They are now very close to each other, but there is no lipping. Are you getting my point? Now they may rub. Will they create more pain or lesser pain? Point is very important. They are now very close to each other, but because of the destructive area, destructive capacity, more destruction is there, regeneration is almost not there. They are coming to close to each other. Will they have more pain or less pain? Actually less pain. Now funny thing is there, when they were greatly separated, properly separated, that was a normal person. When they come close to each other, but with lipping, great pain is there. Further, the actually disease is increasing. But due to more destruction and lesser regeneration, there is no lipping. They are coming further close to each other. But pain reduces. I mean to say that when lipping is there, where there is little destruction, pain is great. When actually disease is increasing, they are coming close to each other, but the pain is decreasing. And that is the famous sentence. There may not be correlation between the reduction in the joint space and the pain. The pain cannot be correlated with reduction in the joint space. Because at the time of lipping, there is little reduction in the joint space, but pain is great. Actually, further if you go, you will find that the reduction in the joint space is more. The bones are coming close to each other, but the pain is decreasing. But when practically they touch to each other, great pain again reappears. Are you getting my point? At the point of lipping, high pain. Greater reduction in the joint space, lesser pain. No joint space, great pain. Are you getting my point? This is the great pain. This is the reduced pain, and this is the great pain. This is the lipping. Here there is minimum lipping or no lipping. Here there is the bones are joining to each other. Great pain, great pain. Comparatively less pain. Are you getting? Now there was one. There was one procedure in between, which is not used today. But in between before few years, there was one procedure. At the time of lipping, the orthopedic surgeons were going for the orthoscopy. They were going for orthoscopy. And what they were doing, they were going for brushing. They themselves going for brushing. What they are doing? That lipping they are going to clear of their own. त्याला गुळगुळीत करून टाकायचे. काय will? There will be reduction in the pain. Significant reduction in the pain. But you are one way helping the pathology. You are actually destructing the bone. And that's why this orthoplasty म्हणायचे त्याला. ते orthoplasty बंद करून टाकली. Orthoplasty is not done in the modern obstetrics, modern orthopedics. Orthoplasty was the procedure where the lipping was cleared, will be cleared by the orthopedic surgeon, cleaned by the orthopedic surgeon. त्याला ऑर्थोप्लास्टी म्हणायची पूर्वी. ते आता बंद करून टाकले. आता करत नाही कोणी. पूर्वी करायचे. Are you getting? Just I want to make you clear that how lipping is important for it. Sorry, I have to read it. Initially, there is loss of the cartilaginous matrix. followed by the proliferation of the chondrocytes resulting in forming the clusters, further loosening and fissuring of the articular cartilage resulting in the breaking of piece of the articular cartilage and exposing the subchondral bone. Already I told you all of these things. The margins of the joint respond to the cartilage by forming of the osteophyte formation. I will show you osteophyte. Small pieces if you find on the X-ray. The radiologist is going to write their osteophytic formation. And when he is writing osteophytic formation, you should understand that it's a case of osteoarthritis. You should remember the point. When small pieces isolated from the joint can be seen around the joint, that is known as osteophytic activity. Increased osteophytic activity is equal to osteoarthritis. These are the cartilaginous outgrowths which later get ossified. Look like lipping of the joint space. Already I told you lipping. Told you? Yes. What is lipping actually? Some degeneration with some regeneration. Odd. Getting it? Yes. Pain is highest at lipping. Pain is very high at lipping. The loosened and the fragmented part may form the loose bodies and they can block the joint. That is what we call joint lock joint. Getting my point? Radiologically, it is seen as reduction in the joint space, and that is the radiological feature of osteoarthritis. How you define osteoarthritis by X-ray? Reduction in the joint space. The very important words I told you. How you decide that this X-ray is showing you osteoarthritis? Very simple, my dear students. Reduction in the joint space. And that is what I always said to my student. That's why you should know how much joint space should be there. And that's why you should have visual memory of normal X-ray. You should have visual memory of normal X-ray. तुम्हाला अंदाज पाहिजे normal X-ray चा. Getting my point? Manifestations of osteoarthritis are commonly seen in the hip, knee and the back. Spine is also involved, yes. Hip and knee are the most common sites, including your back. Osteoarthritis of spine is also noted. The symptoms are more prominent after awakening from the bed. That is what we call actually morning stiffness. You should not be confused with this thing. I should tell you. See, after the hours of, my point is important, after the hours of rest, actually the pain of osteoarthritis should reduce. But you get morning stiffness and you feel that it is the pain. It is not so. I should tell you very clearly. What happens, suppose on the last day night I had a pain, I slept. In the morning when I get up, I cannot walk. Am I right? Yes, and that is what is known as morning stiffness. Point is important. This is for momentarily for 5 to 10 minutes. Am I right? Yes. After 5-10 minutes, the patient can move. And the pain that was there at night has reduced. When? After that 10 minutes, 5-10 minutes. Patient says that in the morning, sir, when I get up from the bed, good pain is there. Actually, that is not pain, that is stiffness. The patient is confusing stiffness with the pain. Stiffness is momentary in this osteoarthritis. It will remain there for 5 to 10 minutes. Once the patient come into motion, that will go off its own. And a day the patient is experiencing good, healthy day, in one way healthy day. Are you getting my point? Yes. In the evening, patient may have the problem because of the fatigue of the day. Getting my point? Yes. In spine, the changes are responsible for the compression of the cervical or the lumbar nerve root and muscle spasm and neurologic abnormalities. Are you getting my point? That will lead to sciatica. Because of osteoarthritis of the bones there, spine. Check the figures always. कंसामध्ये मी फिगर लिहिलेले असतात. Leave it. When you read it at your home, please. Clinical features, one is stiffness I should tell you it is morning stiffness. Typical morning stiffness will be there in the patient. Diminished mobility. Restricted movement means diminished mobility. Restricted movements. Patient will say that नको मला नाही जायचं तिकडे माझा गुडघा दुखतो. Discomfort. General part of osteoarthritis. Pain. Local rise of temperature is seen when inflammation is there. Joint is having the inflammation and pain. Inflammation and redness are the part of osteoarthritis. All this is seen in osteoarthritis. Hervenden's nodes, they are seen sometimes. Outgrowth असतात असे spiral. Not so important. The symptoms are more prominent from awakening in the morning. Already I told you this point. That is what we call morning stiffness. It is momentary. I am repeating my words. This is what I can tell you in the most simple language about osteoarthritis. You should remember only one thing. It is degenerative disease and is a localized disease. It's a process of years together. And that's why don't expect the result within few days. It's not possible. Treatment of osteoarthritis is a long treatment. At least for 6 months, patient should take good medicines, proper medicine, regenerative medicines. Thank you.